Welcome to our deep dive, everybody. Ready to really explore abdominal distension in small animals.
Absolutely. It's a topic that, seems simple at first glance, but there's a lot to unpack.
Yeah, we've got some great research here from a veterinary guide, and we're excited to kind of, break it down.
Yeah, I think it'll be really helpful for clinicians to really understand all the nuances.
Okay, so first things first, let's define what we're talking about. Our source describes abdominal distension as, quote, the expansion or enlargement of the abdominal cavity from any cause.
Yeah.
And that's a pretty broad definition,
Yeah,
right?
yeah. I mean, that's what makes it so tricky. It's not one specific disease, it's a symptom that can have so many different underlying causes.
So it's not as straightforward as it might seem, huh?
No, not at all. It really depends on a lot of factors. The animal's species, their breed, age, even their sex can play a role.
So this is something that every vet needs to be aware of, regardless of, their specific focus.
Oh, absolutely. It's a universal challenge in veterinary medicine.
Okay, so then where do we even begin? How do we start to, untangle this web of potential causes?
Well, one of the first things I always consider is breed predisposition. Certain breeds are just more prone to certain conditions.
Oh, that's interesting. Can you give us an example?
Sure. Like the research mentions Yorkshire Terriers, Wheaten Terriers, and Basenjis. They're all more likely to have protein-losing enteropathy.
Protein-losing enteropathy. And just to remind our listeners, that's where protein leaks from the intestines, right, and leads to fluid buildup.
Right, exactly. And that fluid buildup, of course, contributes to, the abdominal distension.
So if you see a dog from one of those breeds and they're presenting with abdominal distension, that's definitely something to consider right away.
Yeah. It should be high on your list of possible diagnoses for sure. And there are other examples too, like Shar-Pais, they tend to be predisposed to protein-losing nephropathy.
Which is a kidney disorder, right?
Exactly, a kidney disorder. So knowing the breed can really give you a head start in figuring out what's going on.
So it's like a piece of the puzzle almost.
Yeah, it's a clue, definitely.
Right.
But of course, it's not just about breed. There's a whole spectrum of potential causes,
Right. The research here actually lists, well, a whole bunch of things. Pregnancy, loss of muscle tone, fluid accumulation, masses, organ enlargement, gastrointestinal issues. It's quite a list.
Yeah, and it just goes to show, it can range from something pretty benign, like simple constippation,
Right?
to something really serious like hemoabdomen. Hemoabdomen, where there's bleeding into the abdominal cavity.
Oh, wow. Okay, so that's a pretty serious situation.
Yeah, very serious. So it really highlights the importance of, a thorough approach to diagnosis.
Right, because you need to know what you're dealing with before you can even think about treatment.
Exactly.
So then, how do we even start? What are the essential first steps in evaluating a patient with abdominal distension?
Well, the foundation of any good diagnosis is a really thorough history and physical exam. That's where you gather all the clues.
Okay, that makes sense.
Yeah.
But what kind of specific questions are important to ask in these cases?
Well, you wanna get a clear timeline of the distension. Like when did it start? Was it gradual? Was it sudden? Is it constant or does it come and go? You also want to ask about any other symptoms like vomiting, diarrhea, changes in appetite, lethargy.
So you're really trying to get a full picture of what's been happening.
Yeah, as much information as possible. And then, of course, the physical exam is just as important.
Right, that hands-on part.
Yeah, carefully palpating the abdomen, feeling for fluid, for masses, checking the organs.
So you're literally trying to feel what's going on inside.
Exactly. And don't forget to assess their overall condition. Are they bright and alert, or are they, really depressed?
So you're looking at the big picture as well.
Yeah, it all helps. It all gives you clues.
It sounds like you're really emphasizing the importance of that hands-on observational approach.
It's absolutely crucial, but of course sometimes the history and the physical exam they're just not enough.
Right, because you can't see everything from the outside.
Exactly, and that's where diagnostic imaging comes in.
Okay, so what role does imaging play in evaluating abdominal distension?
Well, it lets you visualize the abdominal contents. It gives you a clearer picture of what's going on. Radiographs are often the first step.
Okay.
They give you a general overview. You can see the size and shape of the organs.
So it's kind of like a roadmap almost.
Yeah, that's a good way to put it. But for a more detailed look, ultrasound is really invaluable.
Ultrasound, okay.
Yeah, with ultrasound, you can assess the architecture of the organs. You can see if there's any fluid or masses. You can even guide a fine needle aspirate if you need to.
Oh, wow. So it's like zooming in on the detail.
Exactly. It gives you a much closer look.
This is starting to feel like a real detective story.
A little bit. Yeah.
And I imagine it gets even more complicated when we start talking about other diagnostic tests.
Yeah, sometimes you need more information.
Oh, yeah.
Depending on what you've found so far. You might need to do blood work, urinalysis, maybe even a biopsy.
So it's really about being thorough and taking a systematic approach.
Absolutely.
Well, this has been quite insightful already. We've covered a lot of ground in this first part of our deep dive, and there's still so much more to explore.
Definitely. We're just getting started.
We're just getting started. All right, well, we're going to take a quick break, and we'll be right back to continue our investigation into the fascinating world of abdominal distension in small animals.
Sounds good. Welcome back to our deep dive into abdominal distension. Before the break, we were talking about imaging and how important ultrasound is.
Yeah, it's amazing what you can see with ultrasound. But I imagine there are still cases where it's tough to really pinpoint the cause, right? Even with all the tools we have.
Oh, absolutely. It's definitely not always straightforward. One challenge is that, sometimes owners don't always describe the symptoms accurately.
Oh, interesting. How so?
Well, for example, the guide mentions that some owners, they might mistake fluid buildup for weight gain.
Oh, I can see that, especially if it happens gradually.
Right, exactly. They just think their pet's gotten a little chubby.
Yeah.
And so in those cases, it's even more important to rely on your exam and your tests,
Right. So you can't just go by what the owner thinks is happening.
No, not at all. And another challenge is that sometimes the signs can be very subtle, especially early on.
So you really got to be on the lookout.
Yeah, you have to be very attuned to any little hints that something might be off.
Okay, that makes sense.
And that's where, really understanding all the possible causes and the signs that go with them, that's so important.
Uh-huh.
For example, if you have a patient that's losing weight and they've got a decreased appetite and then their abdomen's slowly getting bigger, that might make you think about something chronic like liver disease or even cancer.
Okay, that makes sense. Whereas if it's really sudden, like all of a sudden their abdomen is distended, that's probably something more acute, right?
Right, exactly, yeah. If it's sudden and especially if they're in pain or they're vomiting or they've collapsed, then you're thinking about things like a twisted stomach or maybe a ruptured spleen.
So it's really about putting all the pieces together, right?
Yeah.
The history, the physical exam, the timing of everything.
Yeah, it's like a puzzle. You're trying to figure out what the most likely picture is.
Okay, I like that analogy. But even then, even with all the pieces, sometimes it's still tricky.
Right. Oh, absolutely. There are cases where even after doing a ton of tests, you're still not 100% sure.
So what do you do then?
Well, then you have to really use your judgment and your experience. Maybe you try a treatment and see how they respond, or maybe you refer them to a specialist.
Right, because sometimes you need that extra help.
Yes, sometimes.
Okay, so we've talked about diagnosis, but what about treatment? Obviously, it depends on what's causing the distension, but are there any general principles?
Yeah, one important principle is to always address any life-threatening problems first.
Okay, so stabilize them first and then worry about the underlying cause.
Right, exactly. So, for instance, if the distension is making it hard for them to breathe, then you need to help them breathe before you can worry about figuring out what's causing the distension in the first place.
So sometimes you're treating the symptom while you're figuring out the root of the problem.
Yeah, exactly. And sometimes that might mean doing a procedure like abdominocentesis.
Abdominocentesis. So that's where you drain the fluid.
Right, yeah. You drain fluid from the abdomen
Yeah.
to relieve the pressure and make them more comfortable.
Okay, that makes sense. And I'm guessing that fluid can tell you something too, right?
Yeah, definitely. Analyzing the fluid can help you figure out, what type of fluid it is, and that can help you narrow down the possible causes. Like, if it's a transudate, that might mean there's a problem with the heart, or maybe their protein levels are low.
Wow.
But if it's an exudate, then that could mean there's inflammation or maybe an infection.
So it's both a treatment and a diagnostic tool.
Yeah, exactly. But it's important to remember that any any procedure that's invasive, it carries some risks.
Right, of course.
Yeah.
What kind of risks are we talking about with abdominocentesis?
Well, the research mentions things like if you take out too much fluid too quickly, that can actually make it hard for them to breathe.
Oh, wow.
Or you could accidentally hit a blood vessel and cause bleeding.
So you got to be careful.
Yeah, you got to be very careful. And it's also really important to talk to the owner,
Oh, right. Make sure they understand.
Explain the risks, explain the benefits, and make sure they're okay with it.
Yeah, communication is so important.
Absolutely. And especially with something like this, abdominal distension, it's important to explain that it's a symptom, not a disease itself.
Oh, that's a good point.
Owners, they often focus on the distension. They see their pet's belly getting bigger, but they don't always realize that it's just a sign of something else that's going on.
Yeah, it's like seeing smoke but not knowing where the fire is.
Exactly. And our job is to help them understand that we need to figure out where that fire is.
Right. Get to the root of the problem.
Right, yeah. And we also need to explain that the diagnostic process, it can take time, It might involve multiple steps, blood work, imaging, maybe even exploratory surgery.
And all of that can be expensive too, right?
Yeah, unfortunately. So it's important to be upfront about the potential cost and talk about the different treatment options, once we have a diagnosis.
So again, communication is key.
It really is.
Okay, so we've covered a lot. Diagnosis, treatment, client communication. Is there anything else we should highlight about managing abdominal distension?
Well, the guide really emphasizes the importance of monitoring the patient after any invasive procedure.
Oh, right. Of course, like after the abdominal centesis.
Right. You want to make sure they're recovering okay and that there aren't any complications.
Okay. What are some things to watch for?
Well, you want to keep a close eye on their vital signs, make sure they're breathing okay, check the incision site for any bleeding, swelling, or infection, and just watch their overall demeanor, their appetite,
So just paying attention to all the details.
Yeah, being very observant. And this is where the vet techs are so important.
Oh, absolutely.
They're the ones that are really hands-on and monitoring the patient's progress.
Right. They're right there with them.
And the guide actually gives some good tips for technicians, like applying gentle pressure to the abdomen after abdominocentesis.
Oh, okay.
To help with the discomfort.
Oh, that's a good idea.
It's those little things that can make a big difference for the patient.
Definitely. And it highlights how it's really a team effort, right?
Oh, for sure. Vets, techs, owners, we all have to work together to get the best outcome.
That's a great point.
Yeah.
Well, this has been incredibly helpful. I feel like we've gotten a much better understanding of abdominal distension, but I'm sure there's still more to learn.
Oh, there always is. Veterinary medicine is always changing. There's always something new to discover.
So we're back, and thinking about everything we've discussed, it's amazing how complex this one symptom can be.
Right. Abdominal distension, it really can be a challenge.
Yeah. But as we wrap up, I think it's important to emphasize that learning never really stops, right?
Oh, absolutely, especially in vet med. There's always new research coming out, new techniques.
Exactly. So how can vets make sure they're staying, on top of all that? How can they stay up to date on the best ways to manage abdominal distension?
Well, conferences are a great way to do that. There are conferences specifically focused on abdominal diseases,
Oh, wow. So you can really dive deep.
Yeah, you can. And you get to hear from experts. You learn about the latest research. You get to connect with other vets who are passionate about this stuff.
It's like a knowledge boost.
Yeah, exactly. And of course, keeping up with the research, reading journals, checking out online platforms that focus on small animal medicine.
Okay, so staying informed.
Yeah. And something else that can be really helpful is connecting with other vets.
Oh, yeah, like talking to colleagues.
Yeah, there are online forums, discussion groups where vets can share their experiences.
It's like a support system almost.
Yeah, exactly. And you can, bounce ideas off each other, learn from each other's mistakes.
Yeah.
And mentorship is another thing I would recommend. Finding a more experienced vet who can guide you, give you feedback.
Especially when you're starting out, that can be so valuable.
It really can. And the most important thing is to just stay curious. Every patient you see, every case you work on, it's a chance to learn something new.
I love that. So as we wrap up this deep dive into abdominal distension, we really want to encourage everyone to Keep learning, keep exploring.
And never stop asking questions.
Yeah, exactly. Thanks for joining us on this journey, and until next time, keep diving deep.
Keep diving.